please tell us about your experience on health informatics training all throughout these years?
Sure. I've been involved in health informatics training for 3 decades, more than 3 decades. And there's certainly been a lot of change in the field as we've gone from more of a kind of research orientation to based on homegrown systems and systems that came out of research projects. And now, of course, in many hospitals around the world, we have commercial electronic health records that require people who are trained really to function more professionally in informatics than as researchers. So even though we still need researchers to do the research and to push the technology, we also need this much larger cadre of people who implement systems in operational settings on a day-to-day basis and support clinicians and administrators and so forth in their use.
Good. So you know that somehow the pandemic changed the way we, from the in-person to the virtual training. So many of your courses are online, but at the university, were you able to quickly change everything from in-person to virtual? And do you think that somehow was quite difficult for people, or people just took it with no problem at all?
Sure. As you know, we have been teaching virtually for at least 2 decades, so we have a lot of experience with that. But at our university, we have students who take classes in person, even though they may be taking some courses that are online, but they're here in person, they're involved in research projects on site. We also have the new clinical informatics fellowships for physicians who train for the clinical informatics subspecialty that we now have in the US. And so the rest of it has had to go virtual for the last year or so. And that's been as challenging probably as it's been for anyone else. Even though in a field like informatics, it's not as hard maybe as, say, when you're doing hands-on patient care or you're a hands-on medical student or nursing student to, it's a little easier in informatics to work and to learn virtually. So we've been able to make that transition, and for the most part, the students have been able to adapt to it, even though many of them are hoping to return to in-person interactions as soon as we can, as have a lot of faculty. There's also been challenges to our department because in addition to the university locking down, a lot of the businesses and the schools have locked down, so faculty and staff are working from home. Many of them, especially younger ones, have children who are going to school from home. And so that's probably been the biggest stress in our entire department is really the faculty and staff. Again, I'm sure the students are eager to get back in person and interact with the faculty in person, but those who have spouses and children and things like that working from home, it's been very challenging.
So the next question would be telemedicine. Everyone discovered telemedicine for those that are not working because it was the way that people on lockdown were able to guarantee the continuity of care. And on your courses and all the training is quite based on telemedicine. Do you think that the approach, new people are going to, new public, new audiences for for telemedicine training would appear? Do you think that the way health informatics training should expand thanks to how the pandemic enhanced all the telemedicine?
Yes, telemedicine has really impacted healthcare in the United States, certainly at our institution. Ironically, as you know, many years ago, I was involved in a systematic review of the use and efficacy of telemedicine and the conclusion of that systematic review is that it was a very kind of niche technology that was not really being used much. That literally changed overnight in the United States last March. And it's shown by the statistics at my institution, which had been trying to develop a virtual visit program with very minimal uptake. Patients really didn't want to do it, except in certain circumstances when they needed to say something quick. But then, of course, when the United States really had a complete lockdown in early March, and so all of a sudden, people had to convert to delivering care via telemedicine, and it just took off at OHSU, my institution, and other places. And we had an institutional goal of 20% virtual visits by the year 2025. We blasted through that barrier again, literally overnight. And about a third of all visits were telemedicine, and even more challenging because whether it was patients, even a lot of our practitioners didn't have good internet connections, weren't used to using telemedicine. So a lot of visits were also done by phone, those were challenging as well. Now, we've had, some reopening in the United States over the months. And so our telehealth visits are back down, I think, to about maybe 20% or something like that. But it's still way above the kind of 1 or 2% it was before the pandemic. And so, and also our informatics department at our hospital was front and center. Actually, it was a great experience for our trainees to have to rapidly implement telemedicine. And so they got that experience. Now, the challenge is, how do we sustain it? How do we integrate it with our existing care? And it makes us in informatics realize that the delivery of telemedicine, telehealth is a component of informatics. In fact, as you know, a number of years ago, we published a paper on competencies for medical students in informatics. And we actually listed the ability to conduct care by telemedicine as one of the competencies for medical students, even though, again, it was such a small thing. But now, clearly, students need training in it. And really in informatics, we need to figure out the best way to support telemedicine, to adding that to how we deliver care. So we probably need to beef up the telemedicine parts of our curriculum, and but not really as a standalone thing, but kind of integrated with how we deliver care now, because probably going forward, telemedicine is going to be a significant part of healthcare delivery.
Great. So let me expand about that, because we were speaking about medical students, and I would say, people that are in training, that are in either nursing or medical, and they're on the graduate portion of their training. What do you think would be the main syllabus for anyone that is starting some kind of career in healthcare, not health informatics, should know about health informatics? Because somehow we are trying to, in Argentina, we are getting together with other people from the country and from the region, trying to make like a handbook for healthcare students, where we address different aspects of health informatics that we think that any healthcare personnel should know about, and not be health informaticians. What do you think about that?
Yeah, no, I think, we published that paper on competencies. We've done a fair amount of curriculum in our medical school. I'm not aware of sort of a textbook for healthcare personnel, although it's a great opportunity for someone who is inclined to do that. I think it's important to define what healthcare practitioners need to know about informatics, just like what, medical students or nursing students, whatever, need to know about cardiology, other kind of clinical areas, and health informatics needs to sit right beside that, because they need to know how to effectively use an electronic health record, how to use it in the presence of patients, how to find information, how to seek out knowledge, be involved in clinical decision support, to understand these new technologies coming down the road like machine learning. Those are actually in those competencies, and then we need to develop probably more detailed specifications of what we think physicians and nurses and others who work in healthcare should know about informatics. It really is a one of the essential sciences of learning to become a clinician. Again, whether it's medicine, nursing, pharmacy, or whatever. And it may differ, between the different professions, but there is probably some core of knowledge that everyone who works in healthcare should know about informatics, just like everyone these days who works in an office, needs to know how to use, Microsoft Office and other, basic kind of software.
Good. Yes, because we were thinking about that project. Not is it? You're thinking that getting all the different universities at Harvard have as part of the career, they have maybe 1 semester, 2 semesters, and to try to unify the content of a manual. Then everyone was able to deliver, the class, how they have a headbook where they could use it for all the students. So we are working on that project. So my last question would be regarding after the pandemic. We still are in the middle of the pandemic. We don't know in the middle, at the very beginning, or we're getting close to the end. But somehow, based on your previous experience and that, what would you think, anything would change in the future regarding how you build up a program for, a master's degree or for a certificate course? What are your thoughts about that?
Yeah. Well, it will be interesting to see, what the world is like when finally, the world has a handle on this pandemic. It will probably, there will probably be, this virus will probably continue to be around, or variants of it. There may need to be booster shots, things like that. I think that the pandemic has driven home that, despite the proliferation of information systems, we still need to do a better job at collecting data and understanding, the spread of the virus, the symptoms, the complications, and then as we move towards vaccination, we see this week, in the United States with the cases of thrombosis related to the Johnson & Johnson vaccine. We need to continue to improve our information systems, and so we have a handle, so we know what's going on. And clearly there's a role for informatics, and as such, we need trained informaticians to be able to develop, manage, evaluate those systems and so forth. Again, as we talked a moment ago, things like telehealth are going to be a much larger part of healthcare delivery. Presumably we'll get back somewhat to traveling, and so that we'll need plans. So when people travel, they can demonstrate that they have appropriate, immunity and things like that. I think that a lot of things will resume toward normal. We may spend less time in very large, closely packed gatherings for some time. I think too, just like telehealth is here to stay, I think a lot of aspects of virtual education are here to stay. There are many things that can be delivered electronically. You and I can sit here and talk real time over tens of thousands of miles over the internet, and it works quite effectively. there's probably efficiencies that can arise through the delivery of materials online and so forth. I think that there's some opportunities coming out of the pandemic and also some cautions that we'll need to take for the emergence of future pandemics.
Good. Do you think there's a role, because we were speaking about data and right now with all the AI hype going on, and what do you think, how we should address to train people in machine learning AI, since it's so big and it's just starting, and they say it might come on your winter and all that. What is your opinion about how to address the training part for AI?
Yeah, well, we're actually addressing this right now. We've in our graduate program, we've just launched basically an applied machine learning course, and there's different levels of expertise required. Most clinicians will not be the people that are building models, machine learning models. They don't necessarily have the background in the math behind all of it, but they're going to play a critically important role in implementing it. So you may have the machine learning experts who can take a well-curated, clean data set of chest X-rays of patients with tuberculosis and not tuberculosis, or lung cancer and not lung cancer, and develop really good models. But then the next big challenge is to figure out how to make those systems useful in clinical settings. We've actually launched we have a computational biomedicine program that has all the kind of people with deep knowledge. And then in our health and clinical informatics is a lot of clinicians, and some of them collaborate with machine learning researchers, and they want to be better collaborators. They want to understand the different types of machine learning models without necessarily, understanding all of the math, or being able to program over large data sets that sit out there in the cloud and things like that. But those people are as critically important as the real machine learning experts to figure out how are we going to make use of this in clinical settings. Like, okay, we have an algorithm that when we put a chest X-ray into it works as well as radiologists in saying that there's tuberculosis or cancer there. How do we implement that in the clinical workflow? How do we handle the results? Does it actually make a difference in patient care? Are we diagnosing more cases? Or maybe are we diagnosing them sooner, and maybe the patients are having better outcomes? Those are the kinds of questions that we really are just beginning to touch on. And I think that, that is why it's really like everything else in informatics, why clinicians need to understand the big picture around machine learning and the different types and how it works and how it's evaluated. And then they can work with the experts to look at, I think initially we'll need to do clinical trials, just like we do of other things, to see how to best implement those things in clinical settings. So I actually think that's a big opportunity for the informatics field. And we're certainly trying to take advantage of it in our program.
Good. You know that here at Hospital Italiano, we have a lot of projects related to AI, and one it's called Artemisia, is to identify nodules in mammograms, and we also conducted the clinical trial to compare, the expert against the algorithm. And we have another one called T-Rex that it reads, chest X-rays and looks for pleural effusions or for bone fractures, and it's really good. So when I listened to you speaking about how it should be conducted, we're actually doing it that way. So it's really, it makes me feel proud of how we are doing it. So, well, I guess that we are 7 minutes and we should finish. Would you like to add anything else? Would you like to tell us about what are your future plans? What are you working currently on? A little bit of what you're doing as ESC president?
Yes, sure. Yeah, well, so in my own work, I spend a lot of time teaching, doing curriculum development, really trying to figure out what are the best ways to teach people what we need to teach them. On the research side, I'm involved with some studies looking at um, reuse of electronic health record data. In one study, we've been looking at the rare disease acute intermittent porphyria, which has some new treatments available. We're trying to determine if we can detect patients. We can identify patients who have the symptoms of the disease, although most of them actually don't have the disease, although they have the symptoms and they have no other explanation for them. But, I think there's some opportunities there. And, I think, just going forward, the informatics field really has an opportunity to try to make the best, as we've always done, make the best use of the technology in the service of patients and their health. And I think that's the most important thing. I mean, it's great to be able to have an algorithm that can pick out a nodule that humans miss. But, again, does that really benefit the patient? Hopefully it will. And then, figuring out how to bring those benefits across the world. And, our academy, which you also have a leadership role too, I think has an opportunity to kind of speak out and spread the word about that, to mentor new trainees up and coming in the field, because we won't be around forever, and keeping progress going forward.
Good, good. Well, Bill, I guess that we addressed most of the topics I was interested in talking with you. So it was a great pleasure to have you. You're always a great friend of ours.
Okay, thank you. I enjoyed getting to
Bye-bye.
chat. Yeah, see you soon. Bye-bye.
Bye-bye.